My name is Balasubramaniam. I am from Tirunelveli. I am a banker basically. In February, while I was in training, I had contacted dengue. So initially, we were admitted in one hospital. We had diagnosed with encephalitis, so we shifted the treatment to Manipal Hospital Sarjapur Road. I fell into unconscious mode with high-grade fever while I am entering into Manipal Hospital. So there they had given excellent treatment at the emergency ward, especially Dr. Niharika Neja. Right time she gave the incubation tube. Then I slipped into coma where they provided with many facilities. Especially Dr. Narayana Swamy and Dr. Rakesh Jadhav worked tirelessly reviving me out of coma.
Hi, my name is Dr. Narayana Swamy. I am the Senior Consultant Critical Care in Manipal Hospital Sarjapur Road. Today I am very happy to talk about my favorite patient, Bala. He is a young patient coming with a history of high-grade fever for 5 to 7 days. When he came over here, his conscious levels were very low. He was barely responding to verbal commands or painful stimulus. In such patients, usually we will put them on ventilator because we want to take control of his breathing, risk of aspiration, all those things. So he has been put on ventilator on arrival at the emergency itself. Then, considering his background of fever, poor neurological status, we have done the brain imaging in consultation with the neurologist here. His platelet count was 2 lakh, which was around 1 lakh platelet count, which was supposed to be 3.5 lakhs and odd, which is the normal level. But we continued the basic supportive care, continuing the basic medication, neuro rehabilitation. We as a team, we never lost hope. We continued the support. He started showing some neurological progress after day 20th. And by day 26, he was making an eye contact, try to obey commands. After day 30th, we shifted him to the ward under the care of our internal medicine physician, Dr. Sunil, to continue the support.
So I was in coma for a prolonged period of 1 month, and then I went into general ward. There Dr. Sunil showed his knowledge. He supported me with various management.
I'm Dr. Sunil Havannavar, Head of Internal Medicine Department, Manipal Hospital Sarjapur Road. After a lengthy struggle in ICU and with a lot of efforts of the ICU doctors, finally Bala was in the ward. And now it was a responsibility on our side in the internal medicine department to take care of him and so that we can send him happily home. So many patients like this. First of all, the dengue encephalitis is not so common, and it was unfortunate that he suffered this infection, and especially the dengue infection affected his brain. And after so much of struggle and the neurological involvement, he was finally out of ICU. There are a very high chance of him getting a secondary infections, especially lung infection, skin infection and urine infections. And because of all this, they will need lot of antibiotic coverage, and because of the long antibiotic coverage, they also suffer lot of fungal infections and also side effects of the antibiotic. Whenever patients like this comes, it is not only the medical management which is important. Other than the medical management, nursing care and the physiotherapy are extremely important.
And I want to specially thank Dr. Indu ma'am. She showed so much empathy in improving my mental condition, and physiotherapy team Juhi and Gajal ma'am were so helpful to walk properly.
We involved our nursing team and the physiotherapy team, and we protocol in such a way that in so many days we have to achieve this. And with the great help of our physiotherapy department and the nursing department, we could finally make him walk. And slowly he was ready to walk by himself. It took little time. He was almost there in the ward for 4 weeks, and after the 4 weeks he was totally independent. He was very happy to walk himself and take his own baby steps.
The Manipal Hospital, especially they are having very excellent facilities. They are very responsive, and the nurse team is so very quick, fast forward, whatever we need they are providing instantly. It was equipped with very high-tech devices, and I am so satisfied with the treatment. Within a fast 1.5 months period, I totally recovered. Now I can able to walk All the staffs were very cordial, nurses were very friendly. So I thanks again Manipal Hospital for saving my life.